Hi, everyone. Welcome to the Alternative Non-Medical Pain Management Strategies webinar. My name is Brittany Swanson. I'm the owner of Becoming Resilient Athletic Therapy and Personal Training. And I have had tons of questions over the last little bit about how we can use some different, more alternative strategies to help with our pain management for issues that would typically be treated more medically with surgery, medications, things like that. So I thought I would jump on here and give you guys some of the knowledge that I've accrued over the last little bit and hopefully give you some alternatives. So the learning objectives for this webinar are here. So we talked about what pain is and how it can be affected at multiple different levels in the last webinar that I did. But I want to recap here in case you missed it, or just so that you can kind of understand why I've chosen to talk about these things as alternatives, because they fit really well into that pain model. We're going to talk about how to use nutrition to help control inflammation and create an optimal healing environment. So if you've gotten by using a lot of non-steroidal anti-inflammatory medications like Advil, this might be something that you want to try. If Advil has been really effective for you and you want to use something that might be a little bit less harmful for your body with less side effects, then using an anti-inflammatory style diet might be a really good option for you. At the end of this, I want you to understand the power of mindset and your mental health and pain management, and how powerful tools that we have, including breath work and meditations and things like that, can really help your pain. We are also going to understand how we can harness nature with foods and essential oils to replace common pain medications. So a disclaimer before we get started. No matter what intervention you use, make sure that you are consulting a healthcare professional, whether that's a doctor, naturopath, athletic therapist, physiotherapist, nutritionist, whatever, one of those things, who is familiar with pain management before undertaking any of these things. No matter what you read on the internet, you should always be kind of green lighting it through one of those sources first. So I posted this on Instagram earlier and Facebook, and I thought that it was a pretty good quote considering our topic today. So to recap pain, we talked about this in the last webinar, but pain is an unpleasant sensation due to real or perceived damage that results in physical or emotional reactions, and then it's processed by your conscious brain. So it goes through the lens of your experiences, your current state, whether that's physical, mental, or emotional. So we can affect it at multiple different levels if we're looking at this from a pain management strategy. So we kind of touched on this. Pain level is dependent on multiple factors. So in terms of physical, we're talking things like your nutrient status, your inflammation. In an acute scenario, acute injury scenario, this might be the severity of the tissue damage. Chronic issue, that's not necessarily the case. We talk about things in physical like sleep or recovery previous to this, other injuries that could be affecting it, things like that. Your mental or emotional state. The factors that are included here would be things like, anxiety, depression, sadness, feeling anxious. We talked about anxiety already, things like that. And then in terms of social, this is the way your pain causes you to interact with the world around you. It also includes things like education about the issue, people who are more knowledgeable about their pain and why it's occurring, and perhaps have better strategies, are less likely to go into a chronic pain state. And those who don't have a lot of information or aren't really supported socially or educationally might have a different experience and more chronicity. So I kind of alluded to the fact that if Advil is something, or non-steroidal anti-inflammatories are something that really help your pain, that the chances are you've got a lot of inflammation in your body and that's what's causing the pain, whether that be hip, knee, back, whatever, it doesn't matter. If Advil works, then you know that your pain has at least some sort of a root in inflammation. And the most powerful way to replace that medication, that Advil, is to look at the foods that you are consuming and maybe make some really positive switches to some more anti-inflammatory foods. This is by far one of my favorite quotes ever written in terms of health and nutrition. So I want a disclaimer here as well, just to say that I am not anti-sugar, I'm not anti-dairy, I'm not anti-gluten, I'm not even anti-processed foods in terms of, you know, like everyone indulges in things like that. But when it comes to inflammation, there's some very common triggers. And if you have an intolerance of some sort, a lot of people have an intolerance to gluten, a lot of people have an intolerance to dairy, then keeping them in your diet is not going to be what helps you get rid of that inflammation. So if you are at a point where this pain has become a really big issue, it might be worthwhile trying to cut some of these things out of your diet. The other really awesome thing about diet is it's not just about cutting things out. It also means adding some things in. And if you can't manage to get yourself to a point where you can cut some of these things out, even just making the switch to add things in and support your body a little bit better is a fantastic idea. So there's a lot of studies to suggest, especially in chronic pain, that people who have chronic pain and are in that pain spasm cycle aren't getting enough protein. I've got a guide that I will link to in the notes here when I upload the video. It's a free guide that I've created to give you all the numbers in terms of water, protein, things like that that you should be eating. It's called Eat, Drink, and Be Pain-Free, and I created that a while ago, so I'll link that in there for you. But not having enough protein has been shown to impact pain negatively. Leafy greens, I mean, that's the foundation of any healthy diet, is to add leafy greens in there. I'm gonna kind of bunch the next three together because they all help with omegas. So having healthy fats in your diet and omegas is really important to support brain health and neuromuscular system health, which we know is a big factor when it comes to chronic pain. So omegas in terms of fish oils, things like that, you can also get them with nuts and seeds and with fiber in the form of ground flax. Fiber is a really big one too, because it is huge for gut health and making sure that you're regular. And if you're not, we'll talk about that in the next slide, but if you're not regular and your gut health is poor, the chances of the above things even making a difference and you being able to absorb those nutrients is a lot less. So, and then of course, water. I mean, your body is 60% water. So I've seen numbers anywhere from an ounce of water per half pound of body weight to full pound of body weight. So you can kind of figure out a number there. Drinking 3 liters of water a day, especially if you're in pain, is probably a decent number to strive for regardless of your size. So I'm going to touch on this just briefly here. However, again, in that ebook that I mentioned, that I will link in the notes, there is so much more about why the gut is so important. But essentially, if you have a leaky gut, inflamed digestive tracts or tissues, you don't absorb the nutrients. So you can shove all the supplements and healthy foods that you possibly want to into your body. And if you're not absorbing it, it's not going to help. So things like fermented foods, things like making sure you've got a diverse, a lot of diversity in your fruits and vegetables. So not always eating the same thing meal after meal. I know a few people who I could tell you exactly what they eat based on the hour or the time of day. And those people are less likely to have a variety of different bacteria in their gut health, or sorry, bacteria in their microbiome, which reduces their level of gut health. So again, I'll link that PDF ebook in the notes, and then you can take a deeper dive into this. If this is a topic that you want me to touch a little bit more on, I'd be happy to do another video about that. So this is kind of a controversial thing, because whenever we talk about pain being a brain function or a signal, people kind of get really defensive and sort of fire back and go, well, no, it's not all in my head. I'm actually experiencing these things. And that's true. When we talk about the power of the mind for pain, and we use these interventions for pain, we're not saying that there is no physical component to someone's pain. We're just saying that it's so multifactorial. And if we don't address things like mindset, we're leaving out a huge piece of the puzzle. And, that's why a lot of people don't get better. So I'll say that before we move forward. So yeah, exactly what I just said. If something's created with the brain, we really need to meet it at its source. And it's not all in your head, but a lot of it is. The other super neat thing that I think can be really helpful, especially when you harness it, is the fact that self-efficacy, which is your ability to believe that you're capable of helping yourself or capable of doing something. And in this context, that would be you're capable of controlling your pain or affecting it positively, is a huge predictor of whether or not you are going to deal with chronic pain. So those people who believe that they understand things, they know, what exercises, what strategies they need to do to get out of pain, are less likely to get into that chronic pain state than those who have no idea. So there are a number of really awesome mindset interventions. Not like this list is definitely not exclusive. If any of these things are something that you would like to try, please get in touch with me, as I can either help you, coach you through some of these things, or give you resources to go and do them on your own. So things like breath work is really powerful. I made a post today about how, with everything that's going on, all the craziness, our sympathetic nervous system, so the fight or flight response, is on overdrive. When you're in a chronic pain state, this is also the case. Like, you don't need a pandemic to happen for you to be in that fight or flight response. You just need to be in pain, period. So using different forms of breath work can be a really powerful way for you to kind of tap back into that rest and digest, or that parasympathetic nervous system. But it also really helps with relaxation, which we know if we can relax ourselves and relax the tension in our body, that we're less likely to feel pain. So breath work is really powerful for that. We've got the body scan meditation, and that's just to bring awareness to different parts of the body. Contract relax methods, which just it means going from head to toe or in whatever pattern makes the most sense for the person, and rhythmically contracting and relaxing and going through and understanding how much control we have over the different muscles in our body to help relax things. Mindful movement, so that means doing exercises and movements that may previously have been triggering, and then understanding with some education what's really happening in the body, why you're getting those pain signals, and sort of working through that pain. This is an excellent way to reintroduce movements that would typically or used to typically cause problems, just so that we can kind of reduce the anxiety. Using mindful movement when you're doing this, it's really important to find a way to calm the nervous system down and do it in an environment that your body feels safe. So I would never ask someone to do a mindful movement session with me in the middle of a busy gym with music blaring and people screaming and things like that. We tend to kind of calm the nervous system down using combination of things like massage, essential oils with aromatherapy, heat, quiet space, a space that these people feel safe in, and then we go through this. And that can be super helpful to get people back doing some of the movements that they've been avoiding for a while. Goal setting and journaling are fantastic, especially if someone has been avoiding tasks because they believe that they're so far away from the things that they used to do or the things that they want to do. So we talk about breaking those big goals into smaller actions, smaller exercises and movements to kind of build people back up. And then all of this can be accomplished with some mindset coaching. So if this is something that you are kind of thinking, if you're dealing with a lot of anxiety around your pain, and maybe a lot of misinformation that you're now learning that you've been given, mindset coaching might be something that would be really good for you in terms of pain management. So if that's something you're interested in, please get in touch. This is another really good quote. Hippocrates has a ton of them. So this is something that previously has been seen as very hokey and alternative, but there was this whole era of people long before medicine had ever reached us, modern medicine had ever reached us, that we're able to deal with pain and health issues simply by using plant medicine. So there are even people today, including Aboriginal people or Indigenous people, who come back to the medicines that their grandmothers used to help with pain and injury and illness, things like that. So there's tons of anecdotal evidence to support a lot of these things, and now there's tons of regular research to support a lot of these things. And I think that we also need to recognize the fact that a lot of these plants and herbs and things are still today in a lot of the medications that they give us. They're just then packed on top with a bunch of synthetic stuff that causes all the side effects and whatnot. So again, before you try any of these things, I would highly recommend consulting with someone. The other thing that I would strongly recommend is, if you're going to try and introduce any of these things, that you try introducing one at a time. So if I want to, wash the windows of my house. I'm not going to take a fire hose and wash everything off. I just want to wash the windows. I want to kind of like dial in and make sure that I'm addressing an issue instead of a small issue with the right thing, instead of packing on a bunch of stuff. Because for one, you're just going to get everything wet if we're using the fire hose analogy. But not only that, if you pack a bunch of stuff on, you potentially are spending a whole lot of money and you don't really know exactly what one thing is helping the issue. So when we talk about using essential oils, for example, we always talk about sampling one oil at a time and then seeing what happens. So some of the common issues surrounding pain are inflammation, pain, and then your nervous system. So I've kind of highlighted, based on these three things, the essential oils and foods and herbs that you may want to try that could help the problem. So you can pause this at any point, write anything down, any of these down that you need. The other thing that I would caution is, if you are using essential oils, make sure that you are getting them from really quality sources. If you look at the sourcetoyou.com website, you can actually figure out or find out which essential oils were tested and found to have, truly the components that they say they have in them. Because there's tons of like dollar store oils, and even, there's oils at our local co-op that I would never use, just because the chances of them being diluted or, not 100% pure is very likely. So if you're interested in these oils, talk to me. I think I've got a pretty good understanding at this point of where you need to source your stuff. Herbs and food is really awesome. We're learning more and more now, and with everyone, doing gardens and stuff this year, like I hope, like us, you have tried to overwinter some of your herbs, or, maybe even planted new ones for inside. So I've got tons in our house. We've got basil and thyme and oregano and sage and cilantro, and I think I have parsley. So we keep these around and cook with them a lot. So I'm going to move over to pain. You'll notice that there are a lot of oils that cross over, and a lot of foods and herbs that help both inflammation and pain. And you'll notice like nervous system support in the next slide. There's a lot of crossover. So what I would suggest is trialing out some of these things that might cross off a couple boxes on the list, because that'll shorten the time that you're experimenting with them. And then nervous system support. So I want to kind of talk about why this is so important. We talked about how there's a huge mental health component, anxiety, depression, things like that are huge factors when it comes to chronic pain. But the other thing is the physical nervous system itself. Your nerve fibers and the nervous tissue need support too. So when it comes to food, things like omegas and a higher fat diet, proteins are really important, but there are also some oils and herbs that help support the nervous system. If you have questions about anything in specific, please get in touch. We'll have a conversation, and then maybe we can kind of narrow down where you should start based on what you've got going on personally. All right, so I would love to help you out with, basically taking all of this information about alternative pain pain management strategies, and kind of condensing it into something more manageable for you. So I've done that I've created a 21-day pain reset program, which basically is going to kind of take you through all of these components and give you tons of resources. So for example, like all the nutrition information that you could possibly need to kind of change your diet around, help support your new pain-free lifestyle. Tons of mindset resources, including, guided breathwork and guided meditation videos, and then some extra movement stuff that I've put in there too, because I think that that's really helpful. And I've compiled it all into 21 days where we go through and we pick, key habits that we want to instill so that you can get past this painful stage in your life. It's called the Pain-Free Habits Program, and it's centered around some really incredible products. So these are products that I've been using for my pain with back pain and now pregnancy and all of these things, and I truly believe in them. So what you do is you'll purchase a kit, and with that you get a free 21 pain-free habits program that I've created. It's on Facebook. You get this fantastic group of people that you'll be doing it with, and you've got lifetime access. So, you do the 21 days, works really well. You can keep on for a little bit, and then if you kind of need to fall back and look at some of these things again, or maybe you want to add in a different habit that was included that you didn't really have time for in the 21 days, you have lifetime access to that and any updated resources in that program on Facebook. So I'm looking for beta testers to go through the program. It's new. I want to make sure that I'm tweaking it so that it works for the people who need it. The awesome bonus about being a beta tester is as we go through, if you find, hey, I really need more support here, rather than just kind of being left with the program as it is because it's already finished, I'm there to add anything that you could possibly need. You just have to ask for it. So the other bonus is I'm going to throw in some awesome products that I use that aren't included in this kit. I'll send them out, some samples, things like that, including cleaner, doTERRA's toothpaste that has no fluoride in it, and xylitol, which is really great for rebuilding teeth. And I'm loving it right now as a pregnant woman who, we always have teeth issues because baby zaps all of the calcium out of our bones and teeth to build its own. It's really important. But anyway, things like that. So I'm going to be throwing in my own bonus products for you to try, just as a thank you for going through and, making sure that this program is like the best possible program that you could need for developing habits that are going to support your new pain-free lifestyle. So if you really want, someone to hold your hand and guide you and give you all the resources of all the things that we talked about today, I want you to get in touch. I will leave my information in the description, and you can let me know that you want to jump on, and we will get started with that. So if you have any questions, I'll leave my email in the notes there for you. You can also jump over to my website, which has a blog and tons of other resources there. If you're interested in jumping on that 21 days of pain-free habits program, get in touch and I would be happy to discuss more with you. If you like some of the information that was on here and you want me to touch more on it in future videos, don't hesitate to reach out and let me know. I'd be happy to cover more stuff for you guys. And with that, I want to say thank you for taking in this information. I look forward to sharing more with you in the future. Bye, guys.